Bismillahirrahmanirrahim. As we move on to the coagulation pathway now, from hemostatic pathway to coagulation pathway, the secondary hemostatic pathway here. We have to divide this pathway into two types. That will clear all concepts. But before we divide it into, we have to just look into all this jumbled up area. It's very simple. Just keep in mind we start in the reverse order from all coagulation factors. Factor 12 is on the top. As there is endothelial injury, collagen is exposed, platelets are adhered. There is also activation of factor 12, that is the intrinsic pathway that leads to the activation of in reverse order 11 and then 9. It skips the 10. The 10 is in the common pathway next. And meanwhile there is another pathway less commonly studied, that is the extrinsic pathway, that enters from factor 7. The 7 is entering into the common pathway. So common pathway contains certain coagulation factor uh, below factor 9, but contain factor 10. And the most important two reactions here are the prothrombin is converted into thrombin, and then thrombin activates the fibrinogen and forms the fibrin monomers. These two steps are most important, and amongst them the most important, which is asked in MCQ, is the last step, or you can say there's a second last step, in fact, that fibrinogen is converted into fibrin monomers. So it's MCQ is asked the most important step in coagulation. So we say it is the fibrinogen is converting to fibrin monomers. Otherwise the first step is always the endothelial injury in hemostasis, but in coagulation specifically asked, the most important step, it is fibrinogen into fibrin monomers, and then those fibrin monomers are converted into a meshwork. Those meshworks are then stabilized, and the stabilization happens with the help of fibrin stabilizing factor or factor 13. So there are different names for different coagulation factors. Most important to remember is factor 13 is called fibrin stabilizing factor. It is all separately, as well as asked that which factor is important in stabilization of the fibrin meshwork, that is cross linkaging of the fibrin meshwork, because in the previous step it is just fibrin monomers. And so we just zoom it out for a while. What is happening here is that once the coagulation state is overreached, the body tries to produce anticoagulants, and those anticoagulants can be of many types. But there is another term used, thrombolytics. Anticoagulants, they do not keep the clot to propagate. They do not let more coagulation to be effective. For example, here we have the heparin as an anticoagulant, low molecular weight heparin, and red thrombin inhibitors. They do not let the cascade to move forward, so they stops the propagation of clot. But once a patient is coming to emergency, he has already the clot inside his coronary arteries. So what we can do, we give it a thrombolytics that destroys the preformed thrombin, that is in basically that thrombin is activating fibrinogen to fibrin monomers, and fibrin monomers are converted into a meshwork. Those thrombolytics are not in fact directly thrombin inhibitor. They are in fact cleaving down the fibrin meshwork. So that has to be kept in mind as well. So this is asked that which is one is a natural antithrombotic. They didn't ask for anticoagulant, ask for antithrombotic. Antithrombotic is that destroys the thrombus, that is plasminogen. We all know that we have many forms from nature as well as from artificial ways, such as altiplase, retiplase, that activates the plasminogen, in fact, inside body that is already present. They activate through tissue plasminogen activator, and then plasmin is formed that cleaves down the fibrin meshwork. So there are three MCQs in this pathway, or you can say four. The first one is mostly the coagulation pathway starts with the factor 12, that is the endothelial injury, factor 12, and intrinsic pathway is mostly involved inside the body. We do not see mostly extrinsic pathway, it is intrinsic pathway. And all the factor 12 to reverse order 11 and then 9 and then prothrombin to thrombin, and only important step MCQ is fibrinogen to fibrin monomer. And then the other is the last step, that the factor 13 fibrin stabilizing factor, once activated, it stabilizes the fibrin meshwork. And then to destroy it or to thrombolize it, we have plasminogen as natural antithrombotic inside our body. And certain drugs are here, they are important, but we'll look just the important stuff here. And you can see that fibrin meshwork, when it is thrombolized, in fact I should have used the other term, it is not thrombolized, it is the fibrinolized, but let's just do it for CPSP and not for concepts, that fibrin meshwork produce fibrin degradation products, because these are produced in DICs, because DIC is a state where both the procoagulant and anticoagulant mechanisms are working together. In fact, in body most of the time both are activated, so do not let clot propagate too much. And these FTPs are, for example, the D dimer. D dimer would be a specific one that MCQ comes, and fibrin degradation product. FDPs are most sensitive ones, so they are more in amount, and D dimer is more specific one of them. So another MCQ, the factor 12, that was the most important factor for intrinsic pathway, links kinin coagulation pathway. The kinin pathway, it has high molecular weight kinin nogen that form the bradykinin that causes vasodilation. We know that that is linked with here. So the factor 12 in fact converts into high molecular weight kininogen that forms the bradykinin, and it causes pain. That is another MCQ. Bradykinin is the main mediator of pain and increased permeability and vasodilation. So now, just to summarize, the other important thing about this uh, pathway is that we have to learn the other pathway, that is the tissue factor pathway, that is extrinsic pathway, that is a smaller one topic, that is starts with the factor 7. So that's why factor 7 is called tissue factor, and this is called tissue factor pathway or extrinsic pathway. So we have to divide both pathways into here and learn the medicines and clinical condition involved with them. First of all, the intrinsic pathway, we learned that it starts with factor 12 contact activation after endothelial injury. As we learned in primary hemostasis, there is a endothelial damage and it activates the primary hemostasis. Then the secondary hemostasis is also activated with factor 12. Factor 12 has another name called Hagman factor. So they had in fact an MCQ where they do not call it factor 12, they call it Hagman factor. So it is a Hagman factor that starts the intrinsic pathway cascade, and it is measured by APTT. You can memorize it in any way you like, that APTT is linked with factor 12 and factor 12 is linked with intrinsic pathway, and that the drug that inhibits the factor 12 specifically is heparin, and that is given IV or subcutaneously, and it is a safer medication in pregnancy. Compared to the extrinsic pathway, we have the tissue factor. We learned that it's a factor 7 that starts, also called a tissue factor, starts the pathway, and it is measured by PT. Sometimes they give only PT, and sometimes they also give the INR. So international normalized ratio is modified form of PT, you can say. The values of these are given in next page. You can remember it from there. So whenever they say that we measure the extrinsic pathway, we measure it by PT, we measure it by INR, and which factor is involved, factor 7 or tissue factor is involved, and the drug that is involved that increases PT or increases INR or involved in extrinsic pathway is warfarin, and warfarin is given orally and it is teratogenic. So we have to clear one more concept here, that most of the medicines that are given orally are teratogenic as compared to IV or subcutaneous, as here warfarin of extrinsic pathway is teratogenic and heparin of intrinsic pathway is safer in pregnancy. Just like we have insulin and metformin in pregnancy, so we do not give a diabetic patient metformin orally just like a warfarin, because that is teratogenic, and we shift that pregnant female to insulin that is subcutaneous just like heparin. So two concepts with same application of teratogenicity here. And then the most important MCQ, that for heparin toxicity we use fresh frozen plasma because it contains all the factors which are involved in intrinsic pathway, most of the factors, and fresh frozen plasma is given immediately. If they ask immediate reversal of heparin toxicity, it would be FFPs. But if they are specific antidote, then it is vitamin K, but that acts late. In an emergency we only use FFP. Vitamin K doesn't act too fast because of chemical reaction carboxylation, we will learn in the next. And in extrinsic pathway we have warfarin. We have to remember it in any way that warfarin, factor 7, PTINR are the extrinsic pathway things, and warfarin is teratogenic as well. So warfarin toxicity can be treated with protamine sulfate. uh, so here we had FFPs for heparin, and here we have protamine sulfate for warfarin. So sulfate has an F and warfarin has an F, to remember. And here we have heparin and Hagman factor or factor 12 to remember. So just to summarize this, that factor 12 has 2-3 MCQs, that it starts the intrinsic pathway cascade, and it is important with APTT, and heparin involves factor 12 inactivation mostly, and it links the kinin coagulation pathway, that is important, and it has another name called Hagman factor, just like that fibrin stabilizing factor is another name for factor 13, and tissue factor is another name for factor 7. And you do not have to remember all these steps, but you just have to remember a few things, that from where it starts, the intrinsic pathway from factor 12, and it has all these characteristics given down, and extrinsic pathway from factor 7, and it has all these characteristics. You can jot it down here on the same page, that you do not confuse them or have to find somewhere else. And that fibrinogen to fibrin monomer formation is the most important step in coagulation, but not the first one. The first one is endothelial injury, as we learned, and the natural plasminogen, body has plasminogen as natural antithrombotic. uh, so here we ends the most complex pathway or pathways of coagulation. You can read the other related stuff around, but these are the MCQs, all highlighted ones and all added points. Just these are the MCQs you have to remember.